You are listening to Belly Birth Beyond with Pelvic Floor Mama. I'm your host, Becca Boeving, pelvic rehab certified coach and mom of two. Welcome to the safe space where no topics of motherhood are off limits and judgment is left at the door. Too many mamas are dismissed when they've got valid concerns. If you're sick of hearing that's normal when it feels otherwise, keep listening. Welcome back. I'm so excited for this week. We have a special guest, and I'll let her introduce herself in a minute. But remember, this whole season is about your story and kind of what you make of it for your pregnancy, your birth, and your postpartum. And I think our guest here, Colette, has some amazing information and just insight, both personally and professionally. And it might get a little spicy. I'm kind of excited to see where this conversation goes. So, Colette, go ahead and introduce yourself, share what you do. We are.
It's always spicy. I love it. I live spicy. My name is Colette, and I am a registered nurse in California, labor and delivery for 8 years. And I, a couple of years ago, started My Friend's a Nurse just to kind of fill the gaps that we have when it comes to educating our parents and with full transparency, right? Everything you really want to know with giving birth, whether it's in the home or a birth center or especially hospital, right? So
Yep.
Can I get an amen?
Yeah, for real. So important.
So important.
Yes.
So that's what I'm doing with My Friend's a Nurse, just building awareness. I'm on social media a lot and doing my best with the reels and stuff. But what it really comes down to is just speaking up about advocating for yourself and for each other and educating ourselves. And then, of course, I'm building the home health agency for maternal and newborn care so I can send skilled nurses to your home when you just want the either early interventions like IV antibiotics or iron, NSTs, ultrasounds, all that medical stuff we can kind of maybe do outside of the hospital if that's your preference. Just giving more options both to providers and to parents that, it's hard. It's hard. You get scheduled for biweekly NSTs at the hospital, right? That means twice a week, you have to go get your baby monitored, usually for a minimum of 20 minutes, but it's usually an hour, 2 hours, 3 hours, right? And then you're fine, you can go home. So, but I have so many moms that either have multiple babies at home that they're taking care of and maybe no transportation, or they have a job that they need to do. They can't get away to come to the hospital. And then the hospital is short-staffed, and now we need a nurse to do these tests. And it can be a lot, especially as more and more moms we see are getting labeled as high risk and needing these extra interventions. A lot of them that we could do at the home. So that's kind of where most of my time is. But when I'm not doing that, I love virtual coaching and helping educate parents.
That is so exciting to be able to offer that for moms. Like, it's so hard there's so many appointments. There's so many things, and it's just hard to get there and do it.
And then you get a little bit of continuity of care, right? We know if you have a midwife, you're going to get the same midwife for the most part that you're going to see, and she can come to your home, and that first visit's an hour long. But when you have an OB and you go in for your appointments, it's usually 10 minutes, right?
Yeah.
And it's just to hear like, everything's fine. Okay, we'll schedule. This is what we're going to do in your next appointment. And it's not really a sit down conversation for, a good amount of time to discuss your fears and your preferences and set some expectations along the way. Really, a lot of what I do is just explaining to my clients what the doctor told them. They're like, well, the doctor said I have to do this and that the dad said this, but I'm still not clear. So sometimes it's just having that extra person that can come do that education for you and then get to know you. So they really know you as a person, besides baseline stuff like your blood pressure, so that I could probably catch it a lot quicker than, someone at the clinic that never seen you. I've been checking your blood pressures now over the past few months. So then when you go home for postpartum, you have the same nurse coming to check your blood pressure. She's going to be able to see things a lot better than someone that's met you for the first time and they're just getting a quick snapshot. Yeah, that's the word. So yeah, it's a continuity of care. I mean, all these things support before, during birth, after birth, just shows such accessible evidence on what that kind of support can do for the baby and for mom, and it lasts a
Absolutely.
lifetime. Yeah.
Yeah, no, that's amazing. So we keep talking about like education and being able to advocate for ourselves, but I think some moms may not even understand. I mean, some don't even understand what we're talking about, what we're trying to get into. So I think what happens is you have like options. So often this is kind of like what I get from a lot of moms is like, hey, my doctor said this is what we're doing. And it's like, okay, but do we know? And you kind of touched on this, like, why are we doing this? Did they give you any alternative options? Did they explain like the risks and the benefits if you do it or if you don't do it? And so often I feel like we're just stuck with this is the option, this is what we're doing. And then that's that. And we don't really understand anything else to be able to ask appropriate questions or the right questions or advocate for ourselves or to have a preference either way. And I think that is so important. Like you should have a say in your birth, in your pregnancy, your postpartum, like all of the things. So you mentioned you do some coaching. So you want to like touch a little bit on, I don't know, some of the most common things you're coaching?
Well, a lot of it is
Which all,
everything you just said.
right?
So it starts at any time in the pregnancy, they can meet with me. And it's so funny because sometimes they come to the appointments and they're like, don't really have any questions. I don't really, and I'll say, okay, well, how did your appointment go? And then we'll get into that. And then as someone that has been around so many pregnant women and doctors, and I understand hospital policies and protocols and diagnoses and interventions so well, I'll be able to see things so quickly and easily, for the most part, that others may not catch. So when you come to an appointment and you're like, well, he said everything looks good. Like maybe I have a little bit of hip pain, and then they start creeping in with the stuff that's, oh, did you talk to your doctor about that? No, I didn't really. Okay, well, let's dive in a little bit more, so then we can, it's just another set of eyes on you during your pregnancy and ears. So I can really just sit there and listen to you, and then we can have a conversation, and it usually just strolls that way. So I can't get into specifics because it's so funny. Each client I have is so unique and the experiences are so different. So, and they're all coming with different doctors and different recommendations. So it really is I love this job that I've set up for myself because I can use all the knowledge that I have and sit and listen and then give them the feedback. It's like I can see the spinach in your teeth. Teeth kind of. It's those that appreciate and value a coach, that understand why you would hire a coach if you go to the gym and you want to see results maybe quicker and more efficiently.
Yep.
Or even like you're going to see a nutritionist or you're going to see someone to help guide you, and it's individualized. And so that's the same thing for your birth because there's so many different ways it can go. And a lot of people are in your team. They're either not as educated, they're not living in your body, right? Let's say if it's your husband or your wife or girlfriend or your mom or your sister, like they're not going to be as educated as probably me unless they, this is their field. And then they're probably have an emotional stake in it. So it's nice that I don't. And then, you have people that are experts in your team that, like your doctor, your midwife, and the midwife, of course, is going to give you a lot of time. But just having an extra set of eyes and ears and then giving my knowledge, because that's all I do. I'm not going to diagnose. I'm not even going to give you any medical advice. You're probably not even going to know my opinion more than likely, right? Like it's just not my place to give my opinion. But I'm going to ask you questions. I'm going to help you come up with some answers for yourself, questions that you may not have even thought of. And I'm going to give you a lot of reasonings that I feel, knowing what I know and my expertise about what the doctor may mean when they are requesting that you do this test or that test, or and that's a lot of the times when I see clients early on, that's what is happening, and they just have someone that can give them some more explanation. And then, like you said, give you all the options. And that's why I said in the beginning about transparency. My education can be very transparent because I'm going to give, I have no stake in the game, to be fair. I don't, like, it's not my baby. It's not, I'm not your provider. I am just going to lay it out and give you those questions that then you can go to your team and ask, and what information you might want to look into a little more with a little bit of more understanding. That's going to really empower you, right, to educate yourself and how to educate yourself properly. Besides scrolling on TikTok and Instagram, which is all fine and dandy, but understand the reels, a lot of the stuff that you're seeing is just to gain your attention, so that you click on it, and then that's what I do. You're going to say, oh, look at that funny reel. Click on me. So then you can work with me so that I can give you more individualized. So it's just snapshot information. So I hope it's fine to go scrolling if you're looking for that, or you just want the snapshot, but really, that high quality education, either through a class or a coach, because coach is just a step up, right? You can go take a class, you can find a course on, getting those biceps or abs, right? But then when you go into the gym and you really work with a coach that's seeing you and understands like your diet and your lifestyle, then your results are going to, and it's a little bit of, I don't want to say motivation, or maybe accountability too.
Yeah, accountability for sure.
Because
Yeah.
life gets in the way, right? So if you have a call with me on Friday and I gave you a little bit of homework this week, and you're just like, which I do, I give books or things, videos to watch, or, conversation to have, then it's you're a little more accountable, because those 9 months go quick and life gets in the way. And sometimes you're pushed to just, I guess go with the flow, or just trust your doctor and think, whatever they say is going to be fine. I'm not going to worry too much. And that's kind of a cop out. Like, I hope you're saying that after you do all your homework and research and really understand your body. But I mean, that's just where I'm coming from, right or wrong, I guess.
Okay, so let's share a bit. I have so many questions though too.
I know, I talk so much.
No, you're fine. So, well, one of my things is, let's share your birth stories, like your first birth, your second birth, the difference between the two. And then I'll bring up my question. I'm going to write it down though, because I'm going to forget it.
That's what I do for sure. I get so wrapped up in the conversation. I'm like, oh, it's my turn to talk. I'm like, I have so many questions. Okay. That's what always happens to me. Yeah. My birth story is pretty interesting. My babies, I have 2 daughters and they're 20 years apart. So that's kind of cool. The first one, I was 19, 20 when I had her. And, I broke up with my boyfriend at the time, because I was like, I do not want to be married. Like, I didn't even think I would ever be a mom or get pregnant. I was just like, I wanted to travel the world and be a free child and rock star. And I was like, okay. But because of how I was raised, I didn't even think twice and that I was going to have her, but I didn't have to have him. So I did it as a single mom, and thank God, looking back, ooh, good choice. Sometimes we make good choices as a 20-year-old, sometimes. But I went into it then kind of alone. My mom and I didn't have the best relationship, so she was very like all natural, and she was holistic medicine before it was trendy. Let me tell you, like she did it all. She gave birth all natural, and breastfed us until we were like 3, all the things. So she was great, but she didn't share it with us, right? So I didn't have a good image. I didn't have any image of what birth looks like at all. Like, it was more like to never have sex and
right.
Be
like
a missionary.
Other end.
Yeah, she didn't even think twice about like, no, you're not, because we were very religious. But there I was being the rebel and got pregnant at 20. So she was pretty upset about that. So I didn't have that support, and I really put all my trust, because that's what I thought you did, in the doctors. And I chose the doctor because by my insurance and what was close to me and who is available. So pick, you're it. Because to me, any doctor is fine. Like at 20 years, I'm like, yeah, he seems nice enough, So
Yep.
whatever he said, I just did. And I had no problems with it, no fear. I was just like, cool, people give birth all the time. So he'll just let me know what I need to know when I need to know it. And I watched the birth story on TLC to age myself. And any movie that I could see that had someone pregnant, I was like obsessed with other people being pregnant because I just wanted that connection, I guess. But I didn't know I could actually reach out to people in my neighborhood. Nobody told me, like I could find groups and support groups, like that there's lactation consultants. No idea why this isn't taught in school. Like, I'm so pissed. Like, could someone let me know? Like anybody? My doctor, they didn't tell me, right? My doctor didn't say anything. It was just like he must fully believe that like either I assumed I knew or was fine with me not having that support or education. I was 20 years old. It pisses me off looking back. Like, really, you're not going to find out more about me and like how much little I know, and that I'm getting all my information from, TriStar Entertainment or whatever movie I was watching at the time with Natalie, whatever her name is. Like, oh my gosh, just looking back is so funny. So yeah, I mean, I was 20, so and physically healthy and everything, so my labor was quick and because when you're young, sometimes it just is quick and with everything on paper. If you saw my birth on paper, I showed up at 1 a.m. and 6-7 centimeters. I delivered I think by 6 a.m. and got my epidural. I had an episiotomy because this was 24 years ago. Back then, everybody, I think, got cut, but nobody told me, right? Like, it was
There's
so
no consent.
routine.
It's just done.
No, nothing.
Yeah, no
Nothing.
consent.
No
It's just
consent
done.
for anything. I think they
Nope.
gave me, I think I was so uncomfortable. I remember I was just like breathing. It was just, everything was just being done to me. It felt like I was in some like accident and I was in the ER or something. I was like, and I've been like, I'm a snowboarder. I've broken some bones. I've been in accidents and it felt that same way. Do you know what I mean? Like, I'm just in there, the way
all
they
the
treated
bustling
me.
going around you and
No one talking to me.
Yep.
Acknowledging me. My ex was like standing next to me because I thought I should have him in the room because it's his baby too. But he was like crying and I'm so, what do they say? The ick. I'm like, this is disgusting. Like, can you stop crying? I'm the one that's having the baby. And you're just all emotional. I'm not like an emotional like person. I guess I don't, now I am. But at 20, I was, and especially with my ex, right? So he was not, she shouldn't have been there. But I wasn't thinking about myself, right? I was trying to be nice. And same with my mom. I let my mom in the room because it's a grandchild. Were we in the best relationship? No, but I was thinking of her. So I was kind of miserable, right? I had all my friends come in the room when they wanted to come, and my dad, and they're just cracking jokes. It's just like, nothing felt like it was about me. Do you know? Like, it was just like I was a patient in a hospital.
Yep.
And, I thought that was how it was supposed to be, right? My recovery in the hospital was pretty miserable. I was not connecting with the baby at all. I would ask them to take her to the nursery because back then they had a little nursery you could take them to if you wanted. Staying in the room was not mandatory in any way. And I was like, great, you can go ahead and take her because I need to sleep because I was so tired. I just felt sick. And they would bring her in. And I mean, I thought this was baby blues. Again, like I heard things on TV and I knew, I'm like, okay, so this is normal. I am supposed to feel so down or just so tired or just wiped out. Like, and it makes sense after what just happened, this crazy train wreck, right? That just happened.
Yeah.
So even though it was maybe a bit traumatic or crazy, in my head, I was like, it's normal. This is all normal. This is how it's supposed to be. I just need to get through it. I'll be okay. My baby's okay. They're taking care of her. I wasn't even sad about not connecting to her. I was that like, I didn't care. I was just like, I'm so out of it right now. That's how it feels, right? When you're having blues, you don't care. I guess. I don't know. That's how I felt. I didn't have the capacity to. I was almost in shock. Like, what just happened to me? And then of course it's that transition, being 20 years old, being like, I'm a mom now. Right. So I had
Mm-hmm.
two anxiety, total panic attacks alone in the room. Right. When she was 2 days old, 1 day old, because she was crying and wouldn't stop. And I was like, I can't fix, I'm not going to be a good mom. Like, I don't even know why she's crying and I can't get her to stop. And I'm like bawling my eyes out, going to the nurse's station, like, please help me. I can't do this. I have no one in here to help me. No one in here to tell me like I can do it and I'm going to be okay. Just like, I felt so alone and I was a wreck. And then I went home. Just like, I mean, they helped me that she just needed her diaper changed, which made me feel it even worse. I was like, Christ, I can't even know what she needed. That was like the simplest thing to check, and I couldn't even do that right. So I was a wreck. And then my mom let me go stay with her for a few days, and but I still felt like crap, right? I felt tired. And again, I just thought it would be a couple of weeks of feeling this way. And I was still very like, I was a good mom, looking at like, I fed her, I woke up, I did all the things. She laid next to me the whole time, but I still emotionally in my heart, like I just wasn't there. My head wasn't anywhere. And I started passing clots the third
Oh
day.
my gosh.
Yeah. And in the bed, the size of my fist, like I could feel them as they slid out. And I ran to the toilet and they started dropping into the toilet, these huge clots. And so we raced me to the ER and they got me in right away. I had retained placenta. And now looking back, I'm
Oh
like, the
no.
doctor was in a hurry. It was like 6 a.m. He probably had to rush over to clinic, and everything happened so fast. So I'm not surprised looking back, right?
Oh my
It was a
gosh.
little too much. And then they left it. So immediately after my DNC, I wake up and I'm back to my normal self. Like, it was crazy. All of a sudden I just was like, where is she? I want her. Where can I get? I was laughing. I was just feeling so. Those whole 3 days, the whole time in the hospital, I was bleeding. I was not good,
Yeah.
right? There's a
Yeah.
piece of placenta in there and I look at pictures now and I was like white as a ghost. And I was like, what? Why isn't anybody saying, is she okay? And maybe my vital signs were fine. Knowing what I know now, like it takes we have so much extra blood in our system that we can lose quite a bit before we start showing signs. But the first sign was that I didn't have energy and I was just tired and I wasn't connecting. My hormones weren't really working right. And this isn't to say like, oh, that's the reason for all baby blues. I think this is quite rare, but understand that if you feel this way, and I wish someone told me, like, advocating for yourself is also saying, hey, I don't feel good right now. Something is wrong, right? I
Yeah,
thought
absolutely.
that something was wrong was normal, but it's
Yeah.
not. It wasn't. So that is my only thing. It's not. Now, if they check, after they check, you make sure your vital signs are good, that you're not bleeding, there's no retained placenta, nothing like that, then we can kind of assume with the doctor that it is probably baby blues, right? Or something else may be happening. And that person needs some extra support, like all around, right? And
Yeah,
then
definitely.
hopefully get through that together. And then if it lasts longer than 2 weeks, of course, then you need to start thinking about this is depression and what you can do about that. But yeah, I got out of it immediately as soon as I came out of the DNC, and that was it. And I, we won't get into my problems with breastfeeding and mastitis. And I gave up on that after like 8 weeks and went back to my normal self. And, it was fine. But I carried that with me a long time and not even realizing it. And it wasn't until, I decided to become a labor and delivery nurse for totally different reasons than that birth, but just because I wanted to be there. Like, I just thought that was be the coolest job ever. Right? I was like, I was a waitress, single mom for 10 years at that point, well, longer, 13 years. And I was like, what am I going to do for a living now? I can't be a waitress when I'm 50. Like, that's crazy. I have so much more to give. And, just all the stars aligned and all the signs were pointing to birth and being part of it in some way. And of course, I didn't know any better. I thought being part of birth meant you're either a doctor or a nurse. like, looking back, I'm like, I'm so done. But I really got into it, and I really started learning about birth and working with doctors. And then, I went to a few home births as a support. I was a doula. I didn't even know what that was. I was just like, I want to be part of it. So I went to support women, and I had no idea that that was a thing, right? I was just did it. And as I went through nursing school, and then I got my first job in L&D right away. That's when I started seeing these births that I thought was like all normal. And I'm like, oh, it is what happened to me is pretty normal. The chaos, the not talk, so how can I support like my past self in that? So I would like make sure I would speak to them, let the moms and the families know what's going on. Be aware of, family or anything that may be intrusive, and really try to talk to her about her preferences and what would be important to her. But there's so much that I couldn't do at the bedside when it came to educating them. I just didn't have the time. There's also, it just wasn't my place kind of as a stranger to insert myself in that way and give them those questions at that point is not the time. So I have to support them. And then as I saw like more doctors doing things without proper consent, or even completely ignoring the consent that wasn't given, right? And the obstetric violence, the racism, the snarky comments that if a woman's BMI is too high, what they would say when it came to like reasons for Pitocin. It's not all like, once you start hearing this and having to say, okay, and then follow through with those orders. And if I didn't, I would, be ostracized. Is that a word? Or fired or anything, right? It was just like they put the fear, and you kind of have to get in line as a nurse. And I did that for 5 years, gone in line, and I wanted to be the best nurse I could be. And it wasn't until, I started traveling and I started seeing how they did things in other hospitals, and was like, oh, wait, I was kind of coming in as more of an outsider looking in.
Yeah,
right? I still was the nurse. Different. I was still doing the thing. But they were doing things so different that I kind of had to quickly learn what was okay and not okay. And then as I was doing that, I was asking why a lot. Like, why were they doing this? And then when I was like, no good reason. And they're also not educating. So all of a sudden, like I started my eyes were open. It's almost like the rose colored glasses were off, or however you want to think of it. Right. And once that happens, I couldn't go backwards. Right. I just couldn't now stay in line. I had to speak up. I still love what I do at the bedside. I love being a labor and delivery nurse, but no, I had to start My Friend's Nurse. I wanted to do My Friend's Nurse forever, especially the home health. And when I saw I had such a lack of support for my old self in my first birth, that I was like, no, we can do something better. What is missing? I had kind of had that entrepreneurial spirit anyway. So I knew one day I would want to start a business, and I was like, what business would I want to start? Well, duh, like let me do whatever I can to support women, and also use my nursing and medical side of it, and bridge that gap between this holistic, home birth group, which I love, and the hospital births, which I love as well. But we both know that it needs some work. So I want to help do that. And my next birth, obviously, with my last daughter, I said they were 20 years apart. She's 4 now. And now that was 4 years ago. So I was still kind of medical. I was still that labor and delivery nurse. So I was totally okay with like an induction and, all the things, the epidural, all the things the hospital has to offer. But let me tell you, going in educated just the same, maybe I wasn't educated like I am now. I may make different choices now, but we come to our birth with the knowledge that we have in that moment, right?
Yep. That's a great way to put it.
Yeah. So I used whatever I had to make sure that I had an empowered and joyful birth, and I was prepared to go any way. And I was a little scared, like, oh, maybe I know too much. Like, oh God, I know the horror sides too. And that was not the case. When I came in, knowing everything that I knew, I was very relaxed. I was very like, I trusted the team that I had built. Like I came knowing who the anesthesiologist was and who the doctors were, who the nurses were. I had that kind of, um, a perk of
Yeah.
going to where I work. So I knew a lot of the things, and that just made me more relaxed. So educating yourself, you think, oh, well, it's better if you're that person that's like, oh, it's better. I don't want to know. I don't want to know. Like, just better that they just tell me as we go, because you think that's going to cause you more anxiety. No, it's not. It's like if you at least understand what your body does in birth, and then maybe some of the questions you could ask if something comes up and you don't have to know everything, but know your body, know some tools for mindset and breath work, and just to prepare yourself for what birth has to offer you, and how to, use it to your advantage and get through it. And get through it by meaning like it's gonna make you a mother. So, it's like, why wouldn't you want to put everything you can into it and no fear? Like, don't like education is going to take away the anxiety, not add to it. I believe that. So I don't know, but I think you would agree.
No, absolutely. It's really hard to like, I don't know, I guess wing your birth or just no, that doesn't work. I had a saying, I was a gymnast and I was like, what's the saying I used to say before I used to like do skills that I didn't feel mentally prepared for? It doesn't work in this setting. I'm not gonna but
Yeah, if
essentially
you want
like
to
wing
ad
it.
lib
Like,
it, you want to like,
yeah.
what is
I used to say
freestyle?
chuck it. I was like, I'm just gonna chuck it. Like, no, that's
Check
not
it.
appropriate
Yeah.
for here, right here. Like that's not gonna work. But that was my saying when I was a mental case as a gymnast. But anyways, and so yeah, it's just really hard. And sometimes, like you said, you don't necessarily want to overstep because it's not your place. And so when moms are like, oh, for instance, I can think of this mom I had in the clinic, and she was in and I was just talking to her because she's like, oh, I think they're going to induce me. And I'm like, oh, okay. So do you know how they're going to induce you, when they're going to induce you, why, and maybe I didn't ask all these questions like that because that's coming at you a little hard.
Sit
But
down.
she was,
Let's talk.
yeah, but I was just like, do you know, like, wait, do you know why they're inducing you? Are you comfortable with that? And she's like, well, I'm not the first person to give birth and I'm not going to be the last and, whatever. And I'm like, okay. So I'm like, are you comfortable having a cesarean then? Like, is that okay then if things go that way? Like, she's like, well, no. And I'm like, okay, so do you think maybe you should, ask a little more questions so you can have a better understanding and like all these things? And she totally shut me down. And I was like, okay, like no problem. Like you don't want to talk about it. That's not the thing. She had a cesarean. She had a really rough birth. And honestly, I didn't wish that on her at all. Like it breaks my heart that happened, but it's just like, you can't help those who don't want to help. And you don't want to inflict fear on moms either, because that's out there. Like that's a thing. So it's like that gentle, like walking that line of like, don't wing your birth, but also like let's not talk about the horror stories. Let's just talk about how you can improve your experience and how you can have a better, I don't know, have a better birth and just have even an easier recovery. And I think so often we're like, oh, it's just pregnancy. I just have to get through, 9 or 10 months, and birth is only, X amount of hours or whatnot. And it's just, well, like this one-time thing for this baby, and then I'm good. But we don't realize that our bodies are with us so much longer than that. And like the trauma or the mental and emotional, I don't want to say load, but like whatever takes place in that during your birth, like you carry that with you. And so if we have, for instance, I had a traumatic first birth and I was getting ready for his first birthday party the day I went in for an induction, and I had like PTSD, like putting his direct decorations up. I'm like crying. And I'm like, I should be feeling happy and excited. Like this is his first birthday. This is our first baby. Oh no. I was like back in that hospital. Like my husband and I were and even now I still kind of think about it. And it's like that. I never get that way with my daughter. My daughter's birthday, I'm like, oh my gosh, I remember it was so, and it's like, that's the type of birth that I want everybody to be able to have. But it's like, it's just hard to walk that line, I guess. So one of the questions that I had though is, let's say you have a first time mom, or you're talking to a group of first time moms, right? Like you do a class or something, and they're all low risk. no issues with their pregnancy, everything's great. They're working with an OB. They're going to deliver at a hospital. What are some things that you would maybe ask them or try to get to know a little bit better? Or what are some things maybe even that you're like, hey, have you talked about this with your provider? Like how would you approach that?
That's a great question. So with everyone, it's all about who is going to be with you during that time, who is on your team, who is your support person, how are they educating themselves, and how are you communicating with them? Because communication, being a leader, learning how to communicate, those things are very, very important for the birthing woman to improve her outcomes, I guess you can say. So, yeah, I would, first thing is always first, no matter who they are, who is on your team. So, have you decided on OB? Okay, great. Have you looked at your other options as well? So, like I said, it's all about exploring your options. Have you talked to any midwives in your area? What do your insurance help you do? I always tell my clients to at least interview or consult with a midwife. Even if you
Oh, yeah.
know you're going to have an OB and you're going to be in the hospital, get yourself on the phone or go have an appointment with a midwife because she's going to have a different perspective than your OB when it comes to birth, when it comes to pregnancy and your body. She's going to have different resources available for you. Like maybe like maybe if they didn't know you, let's say,
Mm.
and they have
Yeah.
no idea that pelvic floor PT is available, then a midwife may, right? She
Yeah.
may help you understand a bit of what your options are when it comes to birth, like moving around, how you want to birth, have inductions, just feel her out and get an idea. So if they're coming with to me, low risk, with an OB in place, going to deliver at a hospital, oh, great. Just to be clear, have you looked at all your options? Even if you want an OB, I would suggest you make an appointment to consult with a midwife. Keeping your I do that all the time.
No, that's a
And
I didn't
yeah,
even think about that. That's such a good one. Because I have
yeah.
friends who ask me, not to cut you off, I have friends who ask me all the time, like, like, what should I do? Because the hospitals around here are not great. We drove like over an hour to ours, and some of my friends would be like an hour and a half, almost hour 40. And I'm like, get a midwife.
Hmm.
If you can do a midwife. One of my friends is higher risk pregnancy, so she can't,
Hmm.
but some of the other ones are low risk. And
Yeah,
and not all midwives are, there's some
totally.
outliers out there.
Totally.
But there's outliers for everything.
Yeah.
But generally they have more of and if you're not a holistic person, like that's fine. But they're more of, they're going to let your body do your thing, and they're going to kind of sit back a little bit more, and like they're going to listen to you, and they're going to
Hmm.
give you more education in your appointments, and I don't know, all the things. So
Right. It's the education. It's like I'm not okay. If I could give him my opinion, I'd be like, get a midwife. What are like? And here's a referral. Like, make sure you get the one that aligns with you and all of that. But I don't give my opinions. I just make sure. Okay, you have an OB and you're going to the hospital. Do you know your other options?
yeah.
Yes, you do. Okay, cool. Moving on. No, you
Yep.
don't. Okay, let's maybe understand what a midwife is, what she
Yeah.
does,
The
what
difference.
what different locations you could give birth
Get
in.
rid of that. Yeah.
Have you considered these? What are the costs? What does your insurance allow? Lay it all out on the table and know your options before you just blindly choose a doctor in a hospital. And that's not to give my opinion on the hospital or doctor or take business away from doctors or hospitals. It's what's fair is fair. They don't get monopoly over birth. Like, stop it. So know your options. And I'm here to give that. And if they're, all of a sudden done, they want the doctor. Okay, so let's talk about your doctor or your midwife. And I have a list of questions. They're like 19 questions. And they're just examples of what you can do. But I say just start a conversation. They don't, and go in kind of being the leader means you're going in there with your partner or your advocate, whether it's your mom, sister, doula, and by the way, also when you go interview midwives, interview doulas too. Like,
Oh yeah. There's
learn who
such a
you're,
misconception about a midwife and a doula.
yeah,
Like
yeah.
they're like, women are like, well, why I have a midwife, why would I need a doula, or vice versa? And it's
Yeah.
like, they're different. A midwife and a doula are so
Yeah.
different.
Yeah. It's like the doctor nurse team, but now
Yeah.
you have yeah. And everyone should start at midwife doula and then work up. Right.
Yes.
But
Yes.
I'm just giving like, hey, do you know what a doula is?
Yeah.
Just know your options and that they're there. If you know what it is and you've talked to one and you decide you don't want one, that's an empowered, informed decision, right?
Yeah.
But
It
if
is.
if you're in the hospital and you're like, "What's a doula?" then that means someone failed you along the way, right? So
Yeah.
so just know your options and who can be from, and also chiropractor and PT, and like there's so many people that you can have on your team, but you got to know they're there, right?
Yeah.
So
Yep.
that's the first
Absolutely.
thing I do is talk about your team and how we're talking to them. And then
That's a great point.
who in your family or your husband or nobody, who's going to be at that birth, right? And then then we start creating kind of, um, well, I start digging in a little deeper and going over what could be on your birth plan. What are your preferences? And those, as we discuss them, should be topics of conversation with your OB or midwife. You're going in there with a notebook with maybe 3 questions ready to go. So it's not like, yes, yes, okay, thank you so much, bye. No, I have some questions. We're going to have a little conversation. I know you want to do this in 10 minutes. So um, I hate to hold you up. I can always send you an email if you prefer, but I have a few questions for you with regards to our birth. Oh, it's too early to have that conversation. Don't worry about that right now. Okay, well, that's a little bit of a red flag, right? Okay, when would it be good to start talking about this? Because there's a lot of information that goes with birth. And I just want to make sure I know you and you know me and what my preferences are, and that we're all informed and have some expectations set. Like how you present yourself in that room, if you can do that as the leader of this birth, that's going to carry on your entire pregnancy and into your birth, right? So your doctor is going to know when they walk in that room to see you, like, oh, here we go. this one wants to have that talk and it up, but I promise you, they're going to look at you like, like, you may think, oh, I don't want to be a trouble. I don't want to be, cause waves or them not like me. No, no, you're just setting the tone for your birth. And if they know that they're going to walk in that, clinic office and you're going to have some questions for them, so they're going to come, ready to answer them and look you in the eyes and face you straight on. And then they should welcome that. They should welcome having an educated patient, right? And that they can have a conversation with. And you're going to listen to them because you hired them as the expert. So it's not shutting them down. It's really curious about what they like. What's your C-section rate? How many moms out of the last 10 were a C-section, or like how many moms in the last 10 or 20 were, did you have to use a vacuum or a episiotomy? Like, I'm just curious. I just want to get to know you and your practice. Do you have kids? Okay. What's your schedule like? How are you going to make it at 3 a.m, or should I expect another doctor? Are you going on vacation? I don't want to be induced with a schedule. So I just want to set some expectations. So valid. These questions are so valid, and everyone should be talking about this. And it's just information that the doctor isn't going to
Be forthcoming.
hand over to you. So
Yeah.
unfortunately, you got to take charge. You got to go in there with that notebook, and you got to start those conversations. And if you're like, oh, I don't want to, I'm not confrontational. I don't know how to speak up. It's hard.
It is hard.
Then bring someone that will, or, hire me so we can have a prep talk before, and I can give you some questions, and then you can go, and then they can be like, oh, where'd you learn all of this? And you say, my friend's a nurse, so get it. So yeah, so that's basically know your team, start the conversation, and be the leader.
Oh my gosh, that is amazing. Yeah, it's so true, because you have to advocate for yourself. And I think so often, especially if you're like a first-time mom, it's a lot harder to advocate for yourself. You
So
have
hard.
more of that like reserves and that timid factor. If you're someone who's like that, there's some moms out there who like teach me your ways, because I wasn't like that until I had my son. And then my husband and I both got like instantly, we got like backbones, we're like, nope, that's not how this thing goes. And I think it just, now you have to advocate for a tiny person, and now your next birth, you want something different or something better, or, you want to be in control opposed to, yes, sir. Yes, sir. Yes, ma'am. Whatever it is.
Yep.
So that's important to have.
Yep.
Well, very
I
good.
agree.
Yeah. That's someone, my friend's a nurse.
That's where it came from. I'm like, because we were saying my friends were texting me so often during their pregnancy and their births. And then I was talking once they all gave birth and I knew I was going to start the business. I was like, what do I call it? And then we were talking to her. She's a lawyer. And I was like, I'm like, man, all my friends are texting me. And I just like, all their friends, like they get to just say my friend's a nurse. And I was like, and it came out of my mouth and I'm like, I should just name it that. And she's like, yeah, that's good. Just name it that. I'm like, I have nothing else. Okay, that's it.
You're like, let's just do it.
Yeah. And I was like, I'll change it later. And it just never changed. You know how it goes.
No, I think it's awesome. My friend's a nurse. It makes sense. And I think that's kind of like what has you stand out from being being like I don't know, like coaching opposed to being at the bedside.
Right.
So that's the difference between the two of them. And it's like, that's what you're getting when you're hiring like a coach. You're getting that personal aspect. You're getting that someone who really cares and wants to see you do so well. Not just someone who's showing up at your bedside. Not that people who show up at your bedside aren't necessarily wanting to see you do well, but you get a variety.
Totally. It's been great. I actually just love virtual coaching. I really get to know these families better than I ever would at the bedside. And then I get to hear their birth stories afterwards. And Kaya's here now. And it's just so exciting to hear their birth stories. And sometimes I have no idea what is even going to be on their plan or how it's going to go. So when they tell me, I'm like, you did what? That's what you chose? And I'm just shocked.
Yeah, no, that is amazing. Well, thank you so much for sharing. So we'll put your link to your podcast and My Friend's a Nurse. It's literally what it is. We'll link that down below so you can check her out. She does virtual coaching, and stay tuned for a lot of the other amazing endeavors she's got up her sleeve. Anything you want to add or say before we sign off?
I don't think so. Kaya's here ready to lose it on me. I just thank you so much for what you do. It's been so nice getting to know you over these last couple of years. And I know I've come onto your group a couple of times to do some talks. It's always about Pitocin. It's a big conversation. So I've just really enjoyed it. And, I just support everyone speaking out about birth, learning about your resource, like what you could have and how your birth could be. And just don't wait till your second to take advantage and get them. You can do it in your first pregnancy. I promise. And of course you're going to learn every time. It's something new.
Yeah, absolutely. That's amazing. Yeah. So those who don't know, Colette comes on to occasionally the labor coaching groups that I do so that the moms can get another side of what it's like to give birth in a hospital. And this last round of labor coaching was amazing. So many moms are like, I have so many questions that I just wrote down to take to my providers. And one of the moms has been actually texting me because one of the reasons she joined is because her doctor's like, oh, you've got a really large baby and this and that. And some of the other providers that she's had in the office, she has been texting me and I'm like, oh my goodness. He was like, I'm going to have a talk with them. That's not appropriate. We don't do things like that. They fear mongered her a few times. So that's a story for something else.
How dare you go educate yourself and come to us with questions.
Yeah. It's so, I'm like, I feel so bad because what if you didn't know all of these things that she does know? I'm like, imagine a mom who has and so we got into some discussions, which will have to be for another time. Thank you so much though for giving us your time, and
you're so welcome. Thank you.
Enjoy your evening now with your daughter.
I will.
So, all right, everybody, we will be back next week. I'll leave everything in the show notes. If you are preparing for birth and you're wanting to have a better experience, make sure you check out Colette, My Friend's a Nurse, down below. We also will be having another round of August labor coaching, which you can sign up in the show notes below.
Always trust
and we
your
will be
gut
reaching out to Colette to see if she can come join us again for another week where you can get her expertise in the community area and be able to ask her questions. Make sure you check out the show notes below.
Keep in touch with me on
Instagram.
Instagram.
Can't wait to start this journey with you. See you next time. Nothing is TMI when it comes to motherhood, and common doesn't necessarily mean normal. Always trust your gut and never stop advocating for the care you deserve. If you enjoyed this podcast, help it reach more mamas like you by subscribing and leaving a review on your preferred listening platform. Keep in touch with me on Instagram by following Pelvic Floor Mama. See you next time.